Okay, hey, we are live today with Heather Elton, and Heather is an RN that is going to be sharing a little bit about herself and a little bit about breast health and how we ladies can take good care of our girls. So, Heather, I'm going to turn it over to you. Thank you for joining us today, and I'm excited to hear what you have to say.
Thank you, Diane. I'm excited to be here. For those of you who don't know me, I'm Heather Elton. Like Diane said, I am an RN. I live in Columbus, Nebraska with I'd like to say my two kids, but they're off at college. So just me and my husband and my dog right now at home. And I have been an RN for 25 years. And for a big chunk of that, I worked in women's health. So breast health is near and dear to my heart. And now I work in home health and hospice. So cancer prevention is even closer to my heart at this point. But I'm excited to be here with you guys today and tell you a little bit, about myself as I just did and help give you some hints to help you stay breast healthy. So I guess the first thing that I'd like to do is I am a ruby ribbon stylist as well. And I, of course, have my own personal favorite camis. I used to say cami, but, we have so many different styles now that there is just so many options. It's really hard to pick a favorite. Maybe I want to put on my original full support or my nursing cami, which no, I'm not nursing, but anyway, I just like the support and the length for work. Maybe after work, I want something with a little less support. So I might, slip into a second skin, or there's even some great new stuff coming, which mine hasn't gotten here yet. It's arriving tomorrow, but that Allure, that's a little something special for when you're, at home with yourself or, wanting to feel a little extra sexy. So, we got it all. But I'm going to tell you about the cami that I am wearing today. So, there we go. So I am wearing our lace full support cami. And as you can see, I am not a little gal. I've got plenty of support here. When I wore a bra, I was a 44 double D. And I just love this because of the extra lift that I get with the lace, the length, the definition. I can crisscross the straps when I want. And it is just absolutely comfortable, absolutely wearable. I told you I was an RN. I wear this thing all day long. But enough about that. Let's move on to breast health. So most of you women have heard for years and years and years, do your breast self-exams, do them monthly. Make sure you're getting that monthly breast self-exam in. But really, breast health is so much more than even just that exam. In fact, the American Cancer Society doesn't recommend breast self-exam alone as a diagnostic tool anymore. But what is very important is that we as women know how our breasts normally appear and how our breasts normally feel. So that's why, even though monthly breast exam isn't so much recommended, it's still recommended that we are familiar with ourselves. And the best way to do that is at least, once a week when you are getting out of the shower. First of all, you want to, or getting into the shower or changing, whatever it happens to be, take a look in the mirror. Look at your breasts. Know if they're symmetrical normally. Most of us have one bigger and one smaller. Know what that looks like for you. Know where those dimples and intricacies are for you. So if you notice anything changing, that's very important to let your doctor or nurse practitioner or PA know about. The other thing is one way you can tell if your breasts are changing is to watch them move in the mirror. And an easy way to do that is to lift your arms overhead and stretch. Plus, it feels really good in the morning or before bed. And watch how they move. Now, when you do check your breasts, What you can do this in the shower because it's more of a feel than a look kind of thing. We all have a tail of tissue that heads up under our arms and lymph nodes that head up under our arms and underneath our breasts. So you want to make sure that you check the area, under your arm, as well as feeling through your entire breast and over the nipple as well. You shouldn't feel, our breast tissues aren't perfectly smooth. They may feel a little lumpy. Some of us have dense breasts, some of us are very soft, and everything in between. But the important thing is that you know what your breast tissue feels like. And by doing that on a regular basis, you'll probably start noticing like some patterns that may go with your cycle, or even if you're no longer menstruating, that will probably, you'll notice some changes. If you do notice something, though, that is not normal for you, it's very, very important. Those can be things like a tender area, discharge from the nipple, change in the skin, hot red spots. Those are all things to talk to your primary provider about, whether that be a doctor or nurse practitioner. So the other thing, with the lymph nodes, one of the things that is very important is that we allow that lymph to circulate. And whenever we wear something that's too tight, that can restrict that lymph flow. And studies are starting to show that restricting lymph flow can contribute to poor breast tissue health. So a little plug for our camis. Because of that variable compression, you girls that have them already know what I'm talking about. Those that don't, make sure you're talking to your stylist. That variable compression allows you to move, allows the cami to move with you rather than constrict you, and allows there to not be anything binding or tight around where those lymph nodes are. Additionally, for breast health, it's like I said, it's more than just knowing yourself. The American Cancer Society now recommends that for women of average risk, to start your mammogram at age 45 and do those annually. If you happen to have a history or you talk with your provider and they think you're at a higher risk for breast cancer, they may have you start earlier between that 40 and 44 age. But that's why it's so important to have that relationship with your provider. The other thing you can do too is take care of yourself. Now, we always hear that maintain an ideal weight. I'm here to tell you that is important. I'm also here to tell you that if you are like me and a little bit on the fluffy side, you're not going to automatically hit that BMI. But what you can do is take it chunk by chunk and look at yourself and try and work yourself down. Even 10% when you're not in that ideal BMI can make a huge difference for your breast health and your cancer risk. Additionally, how you eat and how you exercise plays a huge role. So you want to make sure that you're getting lots of fresh fruits and vegetables and whole grains in your daily intake, in addition to those other things that you like, such as the meat and the dairy and maybe even a little sugar now and then. Additionally, exercise. It doesn't mean you have to go outside and have, and just be drenched with sweat or do a big aerobic exercise. Walking on a regular basis can also help improve our overall health and reduce our cancer risk. So that's pretty much where I'm at. Diane, do you have any questions?
That was fascinating, Heather. And I don't know about the rest of the ladies that are watching this, but I found myself doing what you were doing and stretching and, So thank you very much for giving us those tips. And I really appreciate the knowledge that you are so generously willing to share with us. If any of you ladies have questions, if you can go ahead and put them in the comments area, and either I'll get the questions to Heather and I get some answers, try and get some answers for you, or we'll find somebody that can help you. So thank you again, Heather. I appreciate you, and I appreciate you sharing, helping us to learn better how to take care of our girls. See you next.
Yep. Good night.
Good night.